MRI images are commonly classified based on how tissues appear, and the most important types are T1 weighted and T2 weighted images. Let us first understand T1 weighted MRI images. T1 weighted MRI is mainly used to study normal anatomy. It provides excellent anatomical detail and helps us understand the structure of the brain and other organs. In T1 weighted images, cerebrospinal fluid, water, and most body fluids appear black. Because of this, these images generally look darker overall. Most pathological conditions also appear dark or hypointense on T1 weighted images. This means disease areas usually blend with darker regions and are not very bright. In T1 images, gray matter appears gray, while white matter appears white. This clear differentiation makes T1 images very useful for identifying normal anatomical structures. One important feature of T1 weighted images is that substances like fat appear bright. Hemorrhage, melanin, protein-rich material, and gadolinium contrast also appear bright on T1 weighted MRI. This is why contrast-enhanced MRI is usually evaluated using T1 weighted images. Because fluids are dark and fat is bright, T1 weighted MRI is excellent for assessing anatomy, structure, and contrast enhancement. Now let us move on to T2 weighted MRI images. T2 weighted MRI is mainly used to identify pathological changes. These images are highly sensitive to disease and abnormal tissue changes. In T2 weighted images, water and other fluids appear white. As a result, these images look brighter or whiter overall. Most pathological conditions appear bright or hyperintense on T2 weighted images. This makes it easier to detect inflammation, edema, infection, tumors, and many other disease processes. In T2 images, the appearance of gray and white matter is reversed compared to T1 images. Gray matter appears white, and white matter appears gray. Because fluid is bright and pathology is usually bright, T2 weighted images are extremely useful for locating abnormal areas. In summary, T1 weighted MRI is best for anatomical information and contrast evaluation, while T2 weighted MRI is best for detecting pathology and fluid-related abnormalities. Understanding the difference between T1 and T2 weighted images is essential for accurate MRI interpretation and diagnosis.